You too. Thank you for joining us for this special edition of KPBS News. I'm Maya Trabulsi. During this newscast, we will showcase our reporting on a pivotal week for the COVID-19 pandemic in San Diego. We start with the image we waited 9 months to see. On Tuesday, Rady Children's Hospital administered the first COVID-19 vaccine locally. Emergency room nurse Brittany Randall was among the first frontline healthcare workers to roll up her sleeve. Pfizer created the first vaccine to be distributed, but other companies will release their own soon. The vaccine is a two-step process, and those who receive the first shot will need to get a follow-up vaccine in a few weeks. Vice President Mike Pence is now the highest-ranking government leader to get the vaccine. He received the shot Friday morning. The number of new cases and deaths is soaring. In San Diego, more than 120 people died from COVID-19 just this week. Imperial County is also dealing with a surge. Johns Hopkins University reported more than 3,600 deaths Wednesday, the highest single-day number during the pandemic. Locally, restaurants are back in business after a judge intervened. Jacob Ayer has the story.
Just Wednesday, outdoor dining wasn't an option, but plans quickly changed overnight.
It's been a roller coaster ride trying to get everybody back. Last night, when we got the word, the judge's ruling when we were going to open, we're scrambling, calling all of the employees back to see who wanted to come back.
Wednesday evening, San Diego Superior Court Judge Joel Wofail ruled that 2 strip clubs, Pacers and Cheetahs, could remain open and operate despite the most recent COVID-19 shutdown orders from the state. The ruling appeared to extend to the county's ailing restaurant industry and allowed those businesses to reopen to some extent. Then, Thursday afternoon, Wofail clarified his position.
But the court's intention is that all businesses which provide restaurant service, meaning all restaurants in the County of San Diego, are encompassed within the scope of the court's order. It's not limited to plaintiffs who also provide restaurant service, but it is intended to encompass all restaurants within the County of San Diego.
San Diego attorney Dan Eaton says that the ruling could have larger implications.
Other strip clubs or restaurants in other parts of the state may very well try to use this ruling, although it's not binding precedent, also to seek to have restrictions loosened.
For Alex Navarrete, those loosened restrictions come as good news.
Everybody's very excited. Our patrons are excited. Our employees especially, glad to get them back, especially through these hard times that people want to work. And since the uncertainty right now with the politics, trying to get the unemployment for the employees just so they can have a somewhat normal Christmas.
Businesses still have to follow COVID-19 safety practices based off of the state's tiered system, such as physical distancing and mask wearing. Jacob Ayer, KPBS News.
The goal of shutdowns and stay-at-home orders is to minimize the strain on our hospitals. Despite the measures we've taken, though, County Supervisor Nathan Fletcher says doctors and nurses are making tough choices as resources dry up.
And the reality of the situation we face is our hospitals are struggling. Our healthcare workers are struggling. We are seeing a series of actions that are designed to try and alleviate the pressure on our healthcare system and ensure the availability primarily of our ICU intensive care unit beds. We've seen changes in ambulance diversions. Hospitals have told me directly that they are delaying tumor removal for cancer patients in an effort to make a bed available for a COVID patient. Hospital CEOs have said that they have delayed organ transplants in order to make a hospital bed available for a COVID patient. Our inability to control the spread of COVID-19 is causing hospitals to take extraordinary actions in order to free up space.
San Diego's ICU capacity is measured as part of the larger Southern California region, and this week It hit 0%. That means we have a long way to go to emerge from the state-mandated stay-at-home order, which requires an ICU capacity of 15% or better. This week, KPBS checked in with several local hospitals to see how they're dealing with shrinking ICU capacity. Health reporter Taryn Mento asked UC San Diego Health how it's managing its resources.
About a quarter of UCSD's ICU patients are coming for COVID treatment. Scripps and Sharp are larger, but data they provided showed their ICUs are around 90% full, with 40 to nearly 50% of COVID patients. UCSD's chief clinical officer, Margarita Baguette, says the other patients in their ICU include those in its burn unit, which is the only one in the region, and trauma patients.
So we're seeing a lot more gunshot wounds, motor vehicle accidents, drunk driving again. So we are, right now I had to open up an extra overflow unit so I could decant the amount of high-level trauma patients. I never had to do that before.
Some beds are also holding surgery patients. Baggett says UCSD is evaluating how to pull back on non-urgent procedures to create more room for COVID patients.
We get more demand, not only our own patient population, but requests from other hospitals. We are postponing elective surgeries. We're not postponing all, but we're looking at a certain percentage that we need to help the community and to help our own patients.
But she says UCSD has already had to turn down transfer requests from other facilities.
Is there a decision you've had to make that keeps you up at night?
Is there a decision? I think what's keeping me up at night if I have to start making these decisions.
So right now it hasn't been a decision, because you mentioned earlier that, you have had to say no to some transfers. And so
yes, in my mind, walking the dog last night, yes. I don't know the outcome of that patient. You know what I mean? So yeah, would I worry that, yes, of course, yes. Yeah, it's a horrible time we're in right now.
Taryn Mento, KPBS News.
And now back to the COVID-19 vaccine and its rollout across San Diego. Most of us will have to wait a while to receive it. And in the meantime, questions are being raised about whether people will be required to get the vaccine by their employers. KPBS reporter John Carroll went in search of the answer.
They are nothing short of a miracle of modern science, vaccines for this deadly pandemic that would have taken years to perfect before the new mRNA method being used by Pfizer and Moderna, among others. Along with continued vigilance to the all-too-familiar public safety measures, masks, physical distancing, hand washing, health experts say the vaccines are our way out of this nightmare. But it's likely some people, for a variety of reasons, will refuse the vaccine. So can employers force them to take it? San Diego employment law attorney Dan Eaton says the answer is a qualified yes.
Employers cannot require employees who have medical conditions that would be complicated by the vaccine, and they cannot require employees who have bona fide religious objections to taking the vaccine.
But the number of people who fall into those two categories is expected to be quite small. For everybody else,
employers do have broad latitude as part of their duty to maintain a safe and healthful workplace.
Keith Maddox with the San Diego and Imperial Counties Labor Council says while an important function of unions is to protect workers from what they see as onerous requirements of employers, this case is different.
And so, especially safety and health is one of the most critical things that we have discussions around, is protecting the safety of workers inside of those work sites. And that's definitely what this is.
Maddox says most union members he knows will want the vaccine. And beyond that, he says a lot of union workers are going to play a critical role in getting the vaccines into people's arms.
CVS's and Walgreens, our members, our union members in those work sites are all going to be part of the process of actually giving vaccines.
Back to the law and the question of what employers can do about people who refuse to take the vaccine, the ones who don't have health conditions or sincere religious objections. Dan Eaton says short of termination, employers have another option.
Simply to require employees to continue to wear personal protective equipment, masks, face shields, other kinds of things.
But Eaton says in the final analysis, science moves faster than the law. And he says the acceptance of science and what it tells us about these new vaccines should be the primary focus of society as we move toward the end of the era of COVID-19. John Carroll, KPBS News.
Some of San Diego's large military population is already getting the vaccine. KPBS military reporter Steve Walsh tells us how the vaccine will be distributed to the armed forces.
San Diego's 2 naval hospitals were among the sites to receive the first doses of the Pfizer vaccine. In a teleconference, Rear Admiral Tim Weber, the head of Naval Medical Forces Pacific, says no one will be required to take the vaccine or be reassigned for refusing, at least while it's still undergoing emergency use authorization. Weber stresses the vaccine is safe.
Emergency use authorization has been provided after obviously going through phase 3 trials. So I am actually confident about the safety and efficacy of this vaccine.
The Navy won't disclose how many doses arrived. The first rounds will not be enough to vaccinate the thousands of sailors and Marines based in San Diego. Future rounds will go to troops preparing to deploy and eventually to dependents. For now, Weber says,
the first doses of the vaccine will be given to frontline healthcare workers and first responders, including emergency medical services personnel, security forces, and other essential personnel.
Navy Region Southwest remains at Health Protection Charlie, the second highest restriction, but short of near lockdown. The Navy has recorded more than 18,000 COVID cases among sailors since the pandemic began, including 2 deaths. The numbers continue to climb. Steve Walsh, KPBS News.
A reminder, tracking the COVID-19 virus in your area can be as easy as using your smartphone. Earlier this month, California launched the California Notify app. It uses Bluetooth technology to alert you if you've spent time near someone who tests positive. The app does not collect any personal information. This is an expansion of the free app that was first used at UC San Diego. It's now available for Apple and Android devices. A group of Latino leaders in San Diego are calling for more support for their communities. KPBS reporter Max Nadler tells us this comes after new county data shows the coronavirus has disproportionately impacted Latino people.
3 Latino mayors and other elected officials spoke out on Tuesday morning after new data shows that Latinos are struggling during the COVID-19 pandemic. The organization Mana de San Diego shared data from the San Diego Association of Governments. It shows that half of Latino residents in San Diego live in an area with higher than average COVID numbers. And over 50% of all COVID cases in San Diego are from Latino residents, who only make up 35% of the population. In addition to the health impact, the pandemic has crushed job sectors filled with Latinas.
The hardest hit sectors in the economy were tourism, retail, and education. So if you look at the numbers, the education, retail, and personal services and tourism industry represents 80% of the job losses.
Job losses have been felt hardest in the lowest paying jobs. Of those making between $27,000 to $60,000, the unemployment rate is only 4.2%. But for those making less than $27,000, over 21% are now unemployed.
Latinas so often go unseen, but we are in fact the lowest paid of any demographic in California. We earn about 44 cents on the dollar of a white male counterpart.
The Latina leaders stress that any recovery for these communities will need to prioritize educational and training opportunities for the lowest paid workers in the state.
Reentry programs, focusing on community colleges and local universities to make sure that we're reaching out to the low-income population. They are the ones that need the retraining, population that make less than $27,000.
They also encourage Latinos to get vaccinated for COVID-19 as soon as they're eligible, to help protect a community that's been hit so hard by the virus. Max Nadler, KPBS News.
Border communities are dealing with some of the highest rates of COVID-19 and a sharp drop in business. Restrictions on non-essential travel will continue through at least January 21st. KPBS reporter Matt Hoffman went to San Ysidro, where businesses rely on cross-border traffic during the holidays.
This is a border town. This is the border town. We depend mostly on the death side of, mostly. Not everything, but mostly. So if they're not crossing, people are not crossing, who are we going to sell? It's simple.
In San Ysidro, Sunny Perfumes and Maya's Gourmet Pizza owner Sunil Gakrea says business near the border has been slow.
Oh, I don't even compare it. It's too bad, very bad. Last year, if you were to come in December time, you can't even walk straight. There's no parking. Everyone is doing good, But right now, I'm here and talking to you.
Gakrea relies on the holiday season to bring in the bulk of his sales at his perfume shop.
This is a money maker right now, this month. And nothing going on.
He estimates as much as 90% of his business comes from across the border.
Now what they have to rely on other people who can cross, so they're sending someone for the perfume place. But this one, they have to come to eat.
Just a year ago, he opened up Maya's Gourmet Pizza, but business there has not been easy either, with months of COVID-19 restrictions.
Like hardly surviving, one business, then you open other business, you want to do good, you want to grow, But now instead of growing, you're going down, down, down.
Gakrea has been trying to adapt, recently putting in these 2 patios, but under the new stay-at-home order, outdoor dining is prohibited.
I'm sorry, this is ridiculous, Like I said, that's the word, Doesn't make sense, You've been training us for 9 months. Oh, do that, and we're following everything. And now suddenly say, oh, you cannot even do that.
He's had to lay off 3 employees, but does not want to close.
Hopefully, that's the thing is we have to hold it because I have invested so much. I'm invested financially, emotionally, So I cannot just let it go.
Gakrea is hopeful that news of a vaccine will bring in business, but realizes it's going to be a long recovery.
And it doesn't mean one day open, it's going to be back on the track. It takes time. It takes time.
He says by now people know how to protect themselves from the virus and wishes officials would allow more people to cross into the United States. Matt Hoffman, KPBS News.
On many fronts, this has been a tough year, but for the bike business, 2020 has been a banner year. KPBS video journalist Matthew Bowler takes us inside one of San Diego's busiest neighborhood bike shops, MJ Cyclery in Hillcrest, for this pandemic profile.
MJ Cyclery, this is Andrew. I've worked here just about a year now. I had 2 different jobs. I was here half-time, and then I was up at a restaurant up in UTC at the mall. First closed down, I got let go of that job, and then I went full-time here. And then 2 of our co-workers, one had to go take care of family, the other one's staying at home because they have elderly members there and they don't want to expose them to COVID. Hello, come on in. What's going on today?
I think it's just a tweaker of my front derailleur.
Let me just throw it in the stand real quick. Okay. So everything looks good now. It shifts up just fine. It doesn't rub when you're in the max over here, so I am gonna clean up your chain real quick. Our stock went from the floor being filled to nothing, and then to being filled with just service bikes. I sit on the computer for hours just trying to find parts. That was a short-lived bike here. After tax, it puts you at $9.42 and 81 cents. Tons of back orders of just stuff waiting. About 100 or so bikes on order, and we ordered most of those bikes 6+ months ago. Really hard to get just kind of anything you need. Tubes were in really high demand. Chains, tires, you name it. It was hard for a while. It had just been 3 of us, but just 3 of us just going, and just getting it done the best we can.
But yeah, man, if I could ride my bike occasionally, I would seriously be in the loony bin or drink a lot more alcohol.
That story was by video journalist Matt Bowler. You can find our pandemic profiles and all of our COVID-19 coverage at kpbs.org. Click on the Tracking COVID-19 link on our homepage for reporter stories, updates from the county, and all of the latest numbers broken down by zip code. How do you take an organization that relies on people coming together and keep it going during a time when people cannot come together? In this pandemic profile, KPBS reporter John Carroll talks to the leader of San Diego's largest Muslim congregation to see how they're making it through the crisis.
God can be worshipped anywhere on earth.
That statement by Imam Taha Hassan could probably be agreed to by just about every religious leader on the planet. But of course, when you're talking about organized religion, it's not quite that simple. Hassan leads San Diego's largest Muslim congregation here at the Islamic Center of San Diego in Claremont.
At the very beginning, we had no idea about what's going on and how we should operate.
What Hassan did know back then was the mosque portion of the Islamic Center, this prayer hall, could not be used. That meant, for the time being, coming to terms with a different approach.
So my home should become my house of worship with my family members. Whatever I used to do in the mosque, now I do it at home.
But most Muslims don't have an imam under their roof, so like countless other members of the clergy, Hassan had to figure out how to take things online with some help.
Thank God we have smart people in the community, and they installed all this system, the online system. So we broadcast live on YouTube channel, our YouTube channel, live on Facebook.
But there was still some in-person worship.
When the pandemic hit, the Islamic Center, like many churches and synagogues throughout the county that have appropriate outdoor space, moved their services outdoors. And then, more than 3 weeks ago, when we moved into the purple tier, the center once again moved their services outdoors, here to their playground.
If places of worship are allowed to once again have a limited number of people inside before the pandemic ends, the Islamic Center is ready. You can see the tape marking on the floor from when they were allowed to have a handful of worshipers inside prior to the county moving into the purple tier. But now, with vaccines expected to be distributed soon, Hassan is looking to the future, when his entire congregation can once again fill this hallowed space. But even then, things will never be the same. Lessons have been learned, and Hassan says that's a good thing.
We as clergy, as faith leaders, we should not just stay in our comfort zone, in our house of worship, in our offices, and wait for people to come to us. We need to learn how to reach them out wherever they are.
In the midst of the unimaginable tragedy of this pandemic, the unspeakable grief suffered by so many, it's reassuring to think that the re-examination of things once taken for granted has meant they are now cherished, leading to a sense of hope for the world waiting on the other side. John Carroll, KPBS News.
A UC San Diego student has been forced to finish her last year of college from halfway around the world. In this pandemic profile, KPBS education reporter Joe Hong spoke with Ariana Kubilian about how she's tried to stay connected.
22-year-old Ariana Kubilian planned to stay with her parents in Manila only through the summer. She even booked a flight back to San Diego in time for the start of the school year at UCSD. But as the pandemic worsened through the summer, her plans changed.
My job told me that, everything's online, you don't need to come back. And then there was all the wildfires, and then suddenly a spike in corona cases. So my parents just told me to stay here.
She spent the last 9 months trying to make the most of her final year of college while living in the Philippines. Kubilian says being with her family during this crisis had its upsides.
I certainly liked it more in a way because when I'm there in the States, I was just kind of alone, have to take care of myself. And of course, everything's crazy with the pandemic, so it's kind of nice to be in something so familiar to me.
But it got harder as school started, and she saw her friends and past roommates reuniting and quarantining together. She started to feel isolated.
There was a tough part for me at the beginning of coming here, actually, because I've seen my friends who, it's quarantine, but they're still living together. So it's still that, college experience away from home, being with my friends kind of experience. And I felt like it was me being here, taking away from my experience as a college student, especially it's my last year and stuff.
Kubilian said she started spending too much time on her phone, and the excessive screen time affected her mental health. So she looked for new hobbies.
I really wanted to find something so that I reduced my screen time because I knew that like took a toll on me in spring quarter. So I picked up embroidering because it's like a nice break from just staring at screens. So I really like that one, yeah.
Eventually, she found comfort in journaling. She said it was therapeutic to be able to write down her frustrations about being stuck at home without facing judgment. She eventually learned to appreciate her time with her family.
And I'm in a much better place now because I'm not constantly thinking anymore about what I should be experiencing. And I've like managed to find a way to just be grateful that I can be home.
Kubilian expects to stay in Manila at least until the spring quarter starts in March. When she returns to San Diego, she said she's hoping to salvage the last bit of her senior year. Joe Hong, KPBS News.
And a recap of this week's COVID-19 developments. Vice President Mike Pence received the vaccine on Friday. He's the highest-ranking government official to do so. More than 120 people died from the COVID-19 this week in San Diego County. Imperial County is also experiencing a surge in cases and a big change to lockdown orders as a local judge intervened to allow restaurants to resume in-person service. And that's all for this special edition of KPBS News. I'm Maya Trabulsi, and for all of us here at KPBS, thank you for joining us. Stay safe.